Which type of tracheoesophageal fistula is the least common type? Type A, Type B, Type C, Type D, and Type E. Out of this, least common is Type D, in which there is esophageal atresia with double fistula, means proximal and distal fistula is the least common variety, less than 1%. Tracheoesophageal fistula is an abnormal communication between the trachea and esophagus. It's usually congenital but can also be acquired, often associated with esophageal atresia. It's five type. Type A, in which there is purely esophageal atresia, no fistula, about 8%. Type B, in which there is esophageal atresia with proximal fistula, you can see in type B picture, that is 2%. Type C, in which there is esophageal atresia with distal fistula, it is the most common type, about 85% cases. You can see this type of esophageal fistula, that is type C, that is TEF is type C is commonest type. Type D, in which esophageal atresia with proximal and distal fistula is there, it is less than 1%. So least common is type D. In type E, there is H type fistula. There is no atresia. It's about 5% of cases. Clinically, there is frothing and bubbling at mouth or nose, coughing, choking, or cyanosis on feeding. There is abdominal distension because of air in the fistula, or there are chances of aspiration pneumonia. Diagnosis: prenatally, you can see polyhydramnios with absent stomach bubbles. Postnatally, there is inability to pass nasogastric tube beyond 10 to 12 centimeter. X-ray with coil tube in upper pouch or air in the stomach. Contrast CCT for H-type fistula can be done. Management: stabilization, prevent aspiration, head up position and suctioning, IV fluids, and antibiotic. Definitive treatment is surgical correction, ligation of fistula with primary anastomosis of the esophagus. Sometimes stage repair if gap is too long. Prognosis depend on associated anomaly like Bechtel anomaly, like vertebral, anal, cardiac or tracheoesophageal or renal limb involvement is there. Survival more than 90% in isolated TEF with modern ICU care.